Back in November, I started noticing something was wrong. The cancer diagnosis was confirmed, I think, at the end of January. Not a good time during COVID to find out something's wrong. The hardest bit was actually not knowing when something was going to happen.
As you know, London throughout this pandemic has been hit terribly hard, and the NHS hospitals have faced huge challenges. I think we're all very anxious about how this would affect cancer care. I work at the Royal London, part of Barts. It's got fantastic capacity to look after COVID patients, but obviously a lot of the resources and the teams are being drawn into helping look after those patients. But at the same time, we've got lots of women still presenting to us with gynecological cancers. To be able to still offer them the service that we want to be able to offer them in a different location. The London Clinic is fantastic. It's fantastic for them, it's fantastic for us. This sort of collaboration we haven't seen before, and the work that must have gone on to facilitate it is huge, and I think it's great efforts from both sides.
Getting to hear that something was going to happen, and not only that, but in fantastic surroundings. The London Clinic was great. Really what I wanted was treatment, and I've got it, and I've got really fantastic people looking after me.
The teams there are exceptionally good. The theatres are very good, so we feel very safe doing the type of operations which actually can be pretty major operations.
The fact that the system, whether it's public or private, are working together is just astonishingly wonderful. Teams are working so collaboratively, so it's the same team that you see if you're at Barts or you're in here. That's very reassuring.
The main body of their surgery is happening here, with the peripheral aspects happening at the Royal London. To be able to come to a site which has a clear green pathway, and that makes surgery as safe as possible. So for any patient who's having a major procedure, we would encourage them and advise them to self-isolate for 2 weeks before having their surgery. They're then having a COVID swab 3 days before their surgery, and providing that's negative, they're then able to come into the hospital. We're in the hospital, all the staff are being swabbed regularly. It's keeping our staff safe, the patients safe, so it's good for both parties.
There have been a large number of things at the London Clinic that have been very reassuring. A very clear green route, proper PPE that I've seen very, very well used. The staff, the care, is second to none.
It's been fantastic to be able to collaborate with the London Clinic. They've got their own charitable status that lends them to work in that way as well, so actually it's a great combination.
Working in private, I think we have to do our own share to help the NHS and to ease out the pressure that they're having right now. It gives us pride to work in collaboration with the NHS. Patients, no matter where they're from, NHS or private, we do our best to give them the best experience that we can.